Hi everyone, my name is Abhijit Minhas. I'm a physiotherapist with a keen interest in orthopedics and sports related injuries. And in this video, we're going to try and break down the injuries surrounding the right arm fast bowler from India, Jasprit Bumrah. So Jasprit Bumrah is a right arm fast bowler that plays for the Indian national cricket team and has been known by many as having an unusual bowling style and a penchant or a knack for throwing on those yorkers, which has given him a lot of success for the cricket team in India. Unfortunately for him, his fans and the Indian cricket team, he's been suffering from low back issues for the last couple of years. And in this video, as a physiotherapist, I'm going to break down everything we've known about a back stress fracture, how he may have possibly gotten it, what are some of the exercises, and what are his recovery stages that he might be going through to get back into sports. I'm going to break this down for you, so keep watching the video to know more. Before we jump into the timeline of Bumrah's injuries, I would want to mention that the Board of Control for Cricket in India, or the BCCI, tends to keep most of the player injuries a bit of a hush-hush. They don't want other people to know the injuries, and that's probably because of the competition. And it's a bit different from, say, other leagues like, say, football, American football, basketball, where like you know exactly what injuries are going on. However, what we do know is that he's had a stress fracture, and let's go back all the way to 2019 when this first started. Bumrah was coming back from India versus West Indies tour to the Caribbean, and when he returned back to India, he was complaining of some back pain and went through some x-rays which revealed a stress fracture. Now again, we don't know the exact details of the stress fracture, but mostly just based on the epidemiology of fast bowlers and stress fractures, we know that they tend to suffer a pars interarticularis stress fracture. Following this, Bumrah also faced another injury, an abdominal strain, this time keeping him away from the third test in Australia. The final and the latest injury came in August 2022 when Bumrah missed a game against Australia, few games against South Africa, and was then finally ruled out of the T20 15-man squad for the World Cup, which was very heartbreaking and was a big setback for the Indian cricket team and for Bumrah himself, as this is a tournament that most of the players would love to play and perform in. Now, looking at the epidemiology of the most common stress fractures that fast bowlers tend to have, we know that one of the most common back stress fractures is a pars interarticularis stress fracture. What is it? In this video, you could see basically the pars is the area of the spine which connects the body of the vertebra to the other end of the pedicle, and it's the center portion of the vertebra, not exactly the center, but right behind the spinal cord. And oftentimes this area is injured, not just in athletes, but generally tends to get injured by repetitive stresses. Now, believe it or not, the body is pretty resilient, and a lot of repetitive force over time can cause a stress fracture, which brings us to our next point, that there are basically three broad stages of this injury. The first one being spondylosis, which a lot of people have heard. It is basically irritation of the pars interarticularis just because of, again, sports, repetitive injuries, and there could be many other factors, but definitely seen in baseball pitchers, fast bowlers, overhead athletes, people who are lifting things overhead and tend to arch their back a little bit. So that is the first level. Then the second level would be the pars interarticularis stress fracture, which is actually a break in the pars interarticularis. And the third stage of this would be when, which is called a so this is spondylolysis. And the last stage of this injury is called as the spondylolisthesis, in which one vertebra which is sitting over the other, just because of the break, one of the vertebrae starts to slide over the other vertebra. And if that happens, sometimes, depending on the severity of the injury, the vertebra can actually start to push and compress and irritate the spinal cord, and it can be serious. So those are broadly the three stages of this injury. Now, we're not exactly sure whether Bumrah was only in the first phase or the second phase, but the fact that they said it's a stress fracture tells us that he was in the second stage, but did not have any of those neurological compromises that can happen if the vertebra hits the spinal cord and starts affecting the nerves that supply the leg. Now, the presence of lumbar spondylolysis or a bone stress fracture in the general population seems to be anywhere between 3 to 5%, but in certain studies, and especially in athletes, the prevalence of these kind of injuries is as high as up to 48.5%. However, wait a second, for cricket fast bowlers, the incidence or prevalence of these injuries is anywhere from 24 all the way up to 80%. But one of the questions that a lot of people generally ask is, why is this happening over and over again when Jasprit Bumrah may have some of the best healthcare experts and the best doctors, surgeons, physiotherapists working with him? Well, to get into that, we have to understand the kind of format and the volume of cricket that Jasprit Bumrah is playing. Right now, as a cricketer in that top tier or that kind of echelons of cricket, he's been playing test cricket, one-day cricket, and T20, which is a lot of volume. Oftentimes we tend to focus only on the way a person bowls or the bowling action, but we also have to consider a major factor, which is the workload. Basically, if you were to simply break down a stress fracture, it is repetitive stress injuries onto the pars, which at one point is just gives out because of all the workload that is being put and is unable to recuperate from all the pressure that is being put on it through just hundreds and thousands of bowls being bowled all the time. Now, apart from the overall volume and the workload, which seems to be one of the most obvious factors, the one that seems to be actually highlighted and most famous is the peculiar bowling action of Jasprit Bumrah. It seems like a lot of cricket gurus, commentators, experts, and other former players like Shoaib Akhtar, etc., have commented on his peculiar bowling style as being one of the reasons why he may be suffering a stress fracture. So let's break down his bowling style. Now, a lot of fast bowlers tend to use a long run-up to increase the pace or actually produce the pace that they need to throw the ball really fast towards the batsman. Now, we all know that Jasprit Bumrah has had this peculiar style where a lot of people have pointed out that he seems to have a really short run-up where he does not use the natural pace of running to be able to throw the ball, but rather takes a shorter run-up, and then as he reaches the position through which he releases the ball, he tends to use a lot of rotational swing and power from his body to actually throw the ball rather than use the momentum of running a long distance. Now, if you break down his bowling action, we see a lot of extension. See how the chest kind of seems to stick out as he's bowling. He tends to arch his back, which is one of the top mechanisms of pars interarticularis fracture, which is excessive arching in the lower back. Along with that, the action of rotation in the back, which also tends to cause a lot of repetitive stress on the pars interarticularis. And finally, just the action of like the leg hitting the floor. We now know that the ground reaction force, that's the force that goes through the legs up as the leading leg hits the pitch when the person is about to throw the ball, can be anywhere from 4 to 9% of the total body weight. Now imagine all that force going up through your legs right into the back, where the back seems to arch a bit, and all that force is transferred to that one area with that fast rotation. So he definitely fits into the classic mechanism of extension at the back and a bit of rotation, but doing that forcefully and aggressively compared to other bowlers who tend to run a bit faster. Now, signs and symptoms of such an injury can be somewhat varied, but still can follow a bit of a pattern. So we find that people who have suspected pars fractures may have sore backs to begin with. If it's not a fracture, it's in one of the first stages. But it could also, as it goes into that second stage where that reaction or that force on the pars now starts to lead into just from a stress into an actual break in the bone, generally we find that patients tend to pinpoint around the area that hurts in their back. So it's not a big diffuse area, and as long as it doesn't go into that third stage where the bone starts to now slip forward in front of the other and starts to press on the nerves, we will not find any neurological effects like symptoms going down the leg like pain, pins, needles, tingling, numbness, stuff like that. So those would be some of the signs and symptoms. Often can happen if it's in a stage one, if it's just a reaction to stress, then it could often happen at the end of a game where a player may say that they are just feeling a bit sore or their back hurts, they feel a bit stiff. And when it starts to get progressively worse, then some of the players may complain of pain with jumping, some kind of impact midway through a game, and when it's really severe, it's just impossible to play the game anyway. But at that level or that echelon of cricket, generally players are never pushed to that limit until they don't report it themselves. They're never pushed to the limit where they can actually cause a stress fracture, and generally the teams are pretty proactive with screening for these things and giving patients enough and adequate rest and recuperation and taking them away and providing them the right medicals. Now, the preferred management options for these kind of sports injuries are generally always to a conservative treatment, which is non-surgical. Now, surgery may be required if it does not get better with the conservative management of the or an approach. But what a conservative management basically looks like is rest. So basically taking these players away from that stressful activity, giving the bone enough time to heal, so that now that the bone is strong, you start to slowly rebuild the athlete and slowly introduce them to sports again. Now, this may require a lot of things. It may require a time period where the athlete is away from sports, then a process of kind of build up where they start to do their physiotherapy exercises, strength training, flexibility training, and then slowly start to incorporate movements and sports specific movements which have much higher stress on the body in a very graded fashion. Let's go back to the initial approach though. Now, before I start to talk about what are the various management options for such problems, I would like to mention that there is a lot of debate between what is the right management approach for this, whether an athlete should be braced, which is restrict the spine with a brace which stabilizes the torso, or not to brace. What are the best exercises? So there's a lot of debate, and unfortunately, as a medical community as a whole, we do not have very strict guidelines, where these guidelines may change depending upon surgeon to surgeon, physiotherapist and stuff like that. However, the general understanding is that some of the surgeons would ask the patients or the athletes to stay away from any kind of sports for anywhere to four weeks up to 3 months. So again, depending on the surgeon, those timelines can often change. Now, some surgeons or some doctors may recommend bracing, which is a hard, rigid brace, like a Boston brace seems to be one of the common ones. And again, that Boston brace would just stabilize the torso and it would prevent any excessive movement or rotation, so that if the bone is broken, it has enough time to heal and does not have unnecessary movement. However, this sounds really good in theory, but oftentimes the results of this do not really stand up to a scientific trial, and so everything is kind of up for debate. Some patients or some doctors tend to take the bracing approach and some don't, but we just don't have the right answer to it so far. Now, we would want to take the 4 to 6 week rest period so that the symptoms of the patients or our athletes start to calm down, and after that we can start to slowly work on some exercises. Now, yet again, there's a lot of debate on what should a person be a bit active during this recovery stage or not. We are not exactly sure, but just to err towards the side of caution, we tend to take that approach where we are not pushing our athletes too much, and generally we tend to have them focus on rest enough. And when the symptoms start to subside, then we broadly take the approach of starting to build some core strength. And by core, I don't mean the six-pack. I don't mean just that. I also mean the transverse abdominis, which is this, the rectus abdominis, which is the six-pack, but we've already spoken about it, the external obliques, the internal obliques, the paraspinals, etc. Now, after rest and recovery periods have been established by the sports medical team, which would generally be the doctors and surgeons of the athletes or the cricket team, then comes the period of the exercise, the strengthening and the building back up. And that is performed by yours truly, or people like me, which is of course physiotherapists. So in the physiotherapy part, Basically, the principle is to slowly start to build up strength through the core muscles, and slowly start to add challenging exercises so that we are building the patient or the athlete back up to a point where we slowly start to add some sport specific movements and exercises that mimic fast bowling, which seem to be the highest stressful activities on the body, but it is done in a very methodical process where we are gradually ramping up these exercises, and that's what we basically take care of. These stages are basically divided into 4 categories. The rest and recovery period. Once again, the rest and recovery period, we are still not sure if they should be complete rest, but often we tend to rest until the symptoms are better, and we start to do certain exercises which do not affect the area that is injured, which is the core and the spine, but we still start to work on areas around it. So maybe doing some kind of cardio, some active rest recovery, just working on arms, hips, knees without really moving the torso too much. After that comes the trunk stabilization phase, which is the static trunk stabilization phase in which there's not a lot of movement going on here, but you start to work on building some baseline strength in your core muscles. The next stage after the static stabilization phase for your trunk comes the next one, which is dynamic stabilization phase, which is basically a fancy way of saying some more challenging exercises. So phase 2 or static stabilization exercises could be called as somewhat easy exercises, and then these are called as somewhat challenging exercises. We tend to sometimes make these words really complicated so we appear pretty smart, but at the same time it's not just that, we're also trying to communicate between medical professionals. Anyways, long story short, these exercises are somewhat more challenging, and you would see some of the examples of these kind of exercises or the exercises that are done in this phase of rehab right here. After all this is done, the next part is return to sports, where we start to add even more challenging exercises, where we are starting to recreate some of the movements that Jasprit Bumrah is going to do during bowling, which would be, plyometric exercises, fast-paced exercises, rotational exercises, throwing, catching, jumping, stuff like that. As we can see, some of the videos that were taken from Jasprit Bumrah's Instagram, it seems like he's reached to the point where he's now actually in the 4th phase of rehab, where he's starting to bowl, he's starting to run, he's starting to go into one of those positions that we would definitely try to avoid early in the rehab, which is extension, which is bending backwards, and rotation. And he's starting to do all of those things. He's starting to bowl. He's getting pretty sports specific. So this might come as a good news to a lot of his fans, that it seems like he's not too far away from joining the Indian cricket team again, which I'm sure a lot of you would be really happy to know. Also, again, something to notice that I mentioned earlier in the video, if you see some of his videos now, he is looking jacked. He is looking strong. So if you look at Jasprit Bumrah now compared to just 2 years ago, he definitely seems to have added more muscle, which is good for him. We know that more muscle, more bone strength means hopefully decreased chances of injuries in the future. So hope you've enjoyed this video. Please comment below if you want me to make another video on your favorite athlete. And this is Abhijit Minhas, physiotherapist, signing off until next time.